Hello everyone, this is the Average Pharmacist and welcome back to my channel. As I said in my first video, I made this channel just to inform you guys about interesting things that have happened in medical history, both past and present, and also to inform you guys about the medications you take. So I know sometimes at the doctor's office, the doctor may be too busy to explain your medication questions, or you may go to your local pharmacy and the pharmacist may be too busy to kind of help you out. So basically, I'm here to answer whatever basic information you guys have about any specific drug, whether it's prescription or OTC. So just leave me a comment below and I'll go ahead and make a video on it. It'll be my next video. So after my last video, my lovely sister, Gentile Williams, commented on me to do a video on Clobetasol Cream. So I told her I would go ahead and that'll be my next video. So let's go ahead and get right into it. And as I said before, if you want to know about any specific drug, if you just leave a comment below, that will be my next video, and I will go ahead and give you a shout out on the next video. So the brand name for Clobetasol is called Temavate. Honestly, I've never seen Temavate in the pharmacy, but I just wanted to give you what the brand name is, and I wanted to show you this nice picture of Temavate. However, the generic is called Clobetasol propionate 0.05%, and it's a cream. This is what you'll typically see in the pharmacy, and this is what's typically going to be dispensed to you when you go to pick it up. So Clobetasol is a topical steroid. It has anti-inflammatory, anti-itch, and vasoconstrictive properties. So basically what vasoconstrictive means is that it can narrow blood vessels. Compared to other topical steroids, Clobetasol has super high potency, meaning that Clobetasol is one of the strongest topical steroids that you actually can use. I kind of want you to hold on to this point because we're going to come back to it later. So just store that in your memory. Clobetasol is used for the relief of inflammatory and itching manifestations of steroid responsive dermatosis. So I know that was a lot right there, but it's basically just a fancy way of saying that Clobetasol can be used in skin conditions that are responsive to steroids. Okay, so examples of these kind of responsive skin diseases are like eczema, contact dermatitis, which is a type of inflammation of the skin, and psoriasis, which is a more severe skin disease. And you also can use Clobetasol in other skin diseases also. So I actually have some pictures of these skin illnesses, but it's nothing major. I wanted to go ahead and give you guys a rated G picture. I didn't want to give you anything too hardcore, but if you want to definitely look up some crazy pictures, they do have them in Google. But these are some basic kind of dermatosis, steroid responsive dermatosis that you would see Clobetasol used in. So basically with Clobetasol, treatment isn't going to go past 2 consecutive weeks, and the total dose, it shouldn't exceed 50 grams in a week, just due to the possibility of the drug to suppress the hypothalamic pituitary adrenal axis. So unfortunately, steroids actually do cause this suppression of the hypothalamic pituitary adrenal axis. So I'm going to kind of discuss that further. So from now on, instead of saying hypothalamic pituitary adrenal axis, I'm just going to say HPA. Okay, so basically, you have your adrenal gland, right? They sit on top of your kidneys, as shown here. So what your adrenal glands do is they produce hormones that help regulate metabolism, the immune system, blood pressure, your stress response, and many, many other important functions. However, when the adrenal gland, when it can't produce enough hormones, this leads to adrenal insufficiency. Okay, and this actually isn't good for your body. Okay, so in this picture, we have the HPA axis. So you have your hypothalamus and your pituitary glands, as you can see up here. And these are two very important glands. They basically help the adrenal gland function. So as you can see in this picture here, you have your adrenal cortex, and this is where the adrenal gland produces its vital hormones. However, when you're using steroids, okay, when you're using these topical steroids like Clobetasol, what happens is the steroids actually prevent the hypothalamus and the pituitary gland. It prevents them from secreting important hormones that actually help the adrenal gland function. Okay, and this is going to lead to negative effects on your adrenal gland, and then the adrenal gland actually won't be able to secrete the important hormones that can kind of regulate your body and do some of those things that I said previously. So this HPA axis suppression actually starts pretty quickly after using a steroid, this topical steroid, or even oral steroids. You typically see this 1 or 2 doses after using a steroid. However, the recovery is pretty rapid. It's pretty fast. You recover pretty fast. However, when you use steroids for a longer period of time, then the HPA axis is suppressed longer, and it's going to take longer to kind of get that recovery time. So, as I said before, this HPA axis suppression can lead to adrenal insufficiency. And basically, when you have adrenal insufficiency, you actually have a lot of symptoms, okay? You can have weight loss, you can have dehydration, you can have abdominal pains, you can have vomiting, muscle weakness, fatigue. You will have decreased sodium levels, decreased potassium levels. So, a lot of some severe systemic effects that you'll see. So, if you're using a topical steroid like clobetasol to a large surface area, your doctor is going to have to monitor you periodically, okay, to check for this HPA axis suppression, especially in steroids that are super potent, right? Like clobetasol. So I told you to kind of store that. Clobetasol is a super potent steroid, okay? So for this HPA axis suppression, we definitely need to, your doctor is definitely going to look out for that and kind of monitor you for that. And that's the reason why you can't use clobetasol more than 2 weeks at a time, okay? Because of this HPA axis suppression. And you're only going to be putting clobetasol in kind of small areas, again, due to this HPA axis suppression, okay? So in regards to this HPA axis suppression, it's actually been seen in very low clobetasol doses, topical doses, okay? As low as 2 grams a day for a week. In patients that were treated with eczema, they've seen this HPA axis suppression. Okay, so you can see how a low dose, even though it's a low dose, it still can kind of cause this HPA axis suppression. Okay, so if you happen to be using clobetasol, the cream, and let's say your doctor monitors you, and he sees that you have this HPA axis suppression, okay, they're going to do, your doctor will do one of 3 things, okay? They're going to either just stop the drug, okay? Or they're going to tell you to kind of reduce the frequency of your application of the drug. So let's say you're using it twice a day. They probably will tell you, okay, well, you need to use it once a day, okay? Or they're going to switch you to a less potent steroid. So if you have this HPA axis suppression, these are the options your doctor may take, okay? So if you're going to be on clobetasol, whenever your skin disease is treated, then they're going to immediately discontinue the drug, okay? But if you don't have symptom improvement within 2 weeks, the doctor probably is going to reassess their diagnosis, because they're probably going to have to either use something else or you were incorrectly diagnosed, okay? So with clobetasol, topical, the cream, you can actually have increased blood sugar, you can have excess sugar in your urine, and you can have some manifestations of Cushing syndrome. So what Cushing syndrome is this is what happens when the steroid levels in your body are too high. Okay, you can have weight gain, increased glucose. These are things you see with Cushing syndromes. So these are things that patients tend to have when they're on steroids. Okay, so with clobetasol, the cream, you also should not use it on the face. Okay, why you shouldn't use it on the face is because it can be absorbed faster. The skin on your face is thinner, so it's gonna absorb the drug faster. So you should not put this on your face, and it should not be placed on your groin or underarms. Okay, the reason you don't put clobetasol on your groin or your underarms are because these are parts of the body where skin touches skin. Okay, So if you have a place where skin touches skin, it's going to absorb the steroid really rapidly. Okay. So, and you don't want kind of these side effects that I mentioned before to happen. So that's why you don't place clobetasol, which is has really high potency. It's a highly potent steroid. You don't want to place those in those parts of your body. However, if you have a low potency steroid, your doctor prescribes that, then you can put that on your underarm, you can put that on your face, and, in your groin area if you need to. But with clobetasol, you should definitely stay away from that. Okay. So with long-term topical steroid use, you can actually have thinning of your skin. Okay, and then you can have some of these systemic side effects, which I explained before, whether it's your blood sugar or the manifestations of Cushing syndrome. So basically, you don't want to be on a topical steroid like clobetasol cream. You don't want to be on that for too long. Okay, so if while you're using clobetasol you develop some irritation, you're going to want to inform your doctor immediately, because they're probably going to need to switch you with something else. Okay, so with all that being said, there are a lot of places you can get medications not prescribed by a doctor. When I was working in the pharmacy, I would see people get medications from Mexico, Canada. Maybe if you're living in a country overseas, it's easy to kind of get some of these medications. So, with topical steroids, right, I highly recommend you're monitored by either your dermatologist or your doctor. Just because, as you saw, the things that clobetasol can do, they're gonna have to do lab tests on you periodically if they're gonna want you to be on it for a longer period of time, just to make sure everything in your body is working fine. Okay, so steroids, they work well, but they actually do have some serious side effects. Okay, so I don't recommend you getting medications from overseas, or if you're overseas, you're using these medications like steroids without talking to a doctor first and without following up with a doctor. Okay, so it's very important you use these medications right. And if you're taking them and you don't feel well, then just let your doctor know right away. Okay, I know I mentioned a lot of side effects in regards to clobetasol and topical steroids, but these medications do truly work when they're used properly under the supervision of a doctor. Okay, so just like I said before, make sure you follow up with your doctor, or if you have any questions, if something doesn't feel right, if your wound isn't healing or your rash isn't healing, then talk to your doctor or your pharmacist. Okay, so with my previous video, I just want to keep it nice and short, give you a lot of information in a short period of time. Hopefully you guys retained it, and hopefully you guys liked it. Okay, and if you liked it, then I appreciate it if you hit that like button. And if you want to know about another drug for next time, just hit me up with a comment below, and then that'll be my next video. Okay, hope you guys have a great day.